Hello, this is Teddy Snodgrass. I'm here to give you a brief presentation on how to gain access to and get knowledge of prescribed medications at the point of care. Now, what problem will my particular innovation problem solve? In the basic form, it will save much time with precision prescribing at the point of care. Providers at the point of care might ask themselves, what medication do I prescribe for this particular condition? Does it come in liquid form? What's the usual dose? What's the generic? What's the spelling of that new antibiotic or narcotic? With this particular app, the MPR app, the only thing you have to do is type in the condition, the disease, and you'll have an almost instant access to what you're looking for. You don't need to waste time searching books. That's the old way of doing things. With the MPR app, you can answer your own questions easily, quickly, and very conveniently. Find drug information the way that works best for you. You can look them up either alphabetically, you can look them up by generic name or brand name. You can look them up by therapeutic category, or even by medical condition. What's the benefits? Like I said, saves time, increases accuracy, and provides more time with your patients. Over 1/3 of patient appointment time is spent by the prescriber searching for what to prescribe and how to prescribe. Apps such as the MPR can save an enormous amount of time compared to the traditional book, such as the PDR. Anybody remember those PDRs? So what's known about the problem? Well, the average patient consult on average is only about 15 minutes long. Most providers spend at least a third of that time looking up what to prescribe and how much to prescribe. You can find what you're looking for with the MPR app in an average of 6 seconds. You can't open a book in that length of time. The MPR app ensures your prescriptions are safe. When you write them, it checks for drug alcohol, drug food, and drug herbal interactions. 89% of providers say that drug reference apps are important or extremely valuable to their clinical decision-making processes. 72% of providers use a smartphone for drug information in their practices. And during my interview project, I was able to collaborate with 3 providers that work at the Saley Health Center on the Navajo Reservation, about 91 miles from civilization. That was one of the main reasons was convenience why I chose these 3 individuals, and the other being of their 3 different cultural backgrounds, and thought I might get some different feedback as far as the project goes because of their culture diversity. The first being Dr. Abula, who is from Pennsylvania, and she's an African American pediatric MD. The other one being Kate Padilla. She is from San Antonio, Texas, and she is a Filipino family nurse practitioner. And the last being Caroline Tracy, who lives here on the Navajo reservations, and she's a permanent fixture here, like myself, and she's the Navajo family nurse practitioner. So during the interview process, the initial thing that I did was to ask them a few questions. The first being how they would define innovation. All of them came up basically the similar response, and that it was different from what is currently being offered. As far as what was the most prominent innovative thing in the last decade, after a little bit of thought, they finally got the idea, and all 3 came up with the smartphone. And then I asked them all about what they felt like disruptive innovation was, and then none of them could come up with a response. But finally, after considerable thought, Dr. Abdullah came up with something to the effect that it was an invention that would replace another. All three of the collaborators expressed delight that the MPR app was free. Dr. Abula was particularly focused and liked the steroid charts, especially for the pediatrics problem, the vaccine references, and also the clinical calculators. And as far as Kate, she liked MPR app would be a practical mobile app to use in a workplace. She commented that it gives current news, recalls on drugs, ICD-10 codes. It was a useful app for busy providers who need quick information on medications and treatment algorithms. She also did note that if a developer was going to charge for it, it needed to be commercial free. And as far as Caroline Tracy goes, she came off with a comment that basically provided, she would like to have something that provided side effects to drugs. Well, it offers that information already. The one thing that Caroline did really came up with was during the brain session part of the exercise was that she felt that a good, rather than having to type the stuff in, if it offered something to the effect like Dragon software, that whereby you could just prompt, say a command into the phone, and it would give you the access to the information that you were looking for. As far as it was a good exercise overall. As far as my reflection goes, that was some good input from all three collaborators. All three interviews were focused on, basically, like I said, on the free part. They really liked the free, and I agree with the free myself. Free apps and paid versions of medications are all available for all clinical purposes and general practice. Free is good. I see no reason to pay for something that you really can obtain for free. Turning good ideas into practical tools requires what Thomas Edison said regarding genius, which is basically 1% inspiration and 99% perspiration. So if you want to innovate, get ready to sweat. And you could basically say that today's uncomfortable, innovative tasks or questions drives tomorrow's lasting solutions. So the MPR app is in its 30th year right now. The monthly prescribing reference provides prescribers with the information needed at the point of care faster than any other digital drug information resource. Like I pointed out previously, you can find what you're looking for in the MPR app in an average of 6 seconds. Like I noted before also, you cannot open a book in that length of time to the contents or the index. The MPR app provides the right dose of information and gives prescribers fast access to the most pertinent prescribing information that they're looking for with an interactive, expandable, concise drug monographs. The MPR app is a reliable app that drug information to support any clinical decision-making process. Basically, the way the app works is, like I previously said, it's a very innovational solution to a current problem for most providers. For example, if you were looking for what to prescribe for tonsillitis, you would simply type in tonsillitis, and it would pop up several drugs. You'd get probably at least a half a dozen. It would take you right there. And what to prescribe. Then you would just basically, if you want to know what to prescribe after that, or how much to prescribe, or the particular dose, you just click on that particular drug that you want to prescribe, and it'll give you all that information. The app is mobile. Like I said, 72% of the providers use a smartphone for drug information in their practices. The MPR app is a reliable app for drug information to support any clinical decision-making process. Of those providers that do use the MPR app, like 55% of those providers reference it more than once a day. They're constantly referencing it all day long. It's evidence-based. It's shared knowledge. As far as the MPR app, technology constitutes only one of the many factors that affect the sharing of knowledge. The sharing of knowledge constitutes a major challenge in the field of knowledge management because some tend to resist sharing their knowledge with the rest of the community. It's very easily accessible, and it's done right there at the point of care at the very moment that you're ready to prescribe. So the best way to predict the future is to create it. And here is the references I used to obtain the information that was just presented.